This video will be reviewing the SOAP note and presentation style. So the first portion is the subjective portion. This is the section where you would report what the patient or their family mentioned to you about their symptoms or their state. This can include answers to a review of system questions, such as if the patient had chest pain, had a bowel movement, or had a headache. You can also mention comments made by the nurse or other healthcare providers, as well as what new referral notes mentioned. You can also state overnight events in this section, such as if a patient was afebrile or if they did have a fever, what the Tmax was and when that occurred, as well as any PRN medications that the patient received. The next section is the objective section. This includes vital signs such as temperature, blood pressure, heart rate, respiratory rate, and pulse ox. You can also include your physical exam findings in this portion, but do not interpret them. Include any labs. Make sure you mention the pertinent ones. You don't necessarily need to mention all lab values. You can also give results for any new imaging that was done within the past 24 hours or overnight. And anything else that was objectively measured, such as an EKG, weight, or any other exams. The next section is the assessment section. You can give a little introduction to your patient in this section, so you can give their name, their age, their sex, pertinent past medical history, and what they're there for. Can be a diagnosis, a differential diagnosis, or even just a symptom. And then you can also mention the hospital day number. Then you mention the status of the patient. And this is the true assessment portion. So you can say today the patient is, and then however you are assessing the patient. Next, we look at the plan. This can be done by listing each problem that the patient has. So you want to list the most serious problem first. So examples of different problems can be hypertension, hypercalcemia, shortness of breath, or you can list the plan by system. So commonly we see different systems listed, including neuro, pain, psych, CV, respiratory, FEN-GI, which is fluids, electrolytes, nutrition, and GI, GU, endocrine, heme, ID, or infectious disease, prophylaxis, and dispo, or disposition. Other areas that you can include in the systems list include spiritual, musculoskeletal, rheumatology, HEENT, dermatology, or lymphatics. And in each section, whether it's by problem or by system, you can discuss any further diagnostic tests that you would like to order, the current treatment or a suggested treatment plan, any referrals that you would like to get, or any patient education that needs to occur. So here's just some general notes about SOAP. SOAP notes and presentations are used when the team knows the patient. So for example, if you have a new resident or a new attending, you can start with the introduction part of your assessment and then get into the history of the hospital course if necessary. Then you start your presentation as normal with the subjective, then objective, and when you finally get back to your assessment part, you can just mention the status since you already introduced your patient. Many people group the assessment and plan portion, which is fine. You just need to assess each problem or system as you go down the list. Make sure you know all the medications. This includes the doses, the schedule, or if it's PRN or as needed, and the reason that all the medications are given. This can usually be listed under the plan portion of your presentation or note. Make sure you interpret all the aspects that you're bringing together for your SOAP note or presentation. Don't just report all the different facts. Try to put it together like a story. And make sure you try to give the plan a shot. Don't just report what the nurse suggested or what the resident believes the attending will want to do next. try to think of a new idea, and it will really prove to your attending and your team that you're thinking about your patient and what ideas you have for them. Make sure you're presenting the pertinence. What I like to do is complete my SOAP note in Epic before I go on morning rounds. And then when I'm doing my note, I bold or underline the pertinent aspects of the SOAP note that I want to make sure I touch upon in my presentation. And note the details just in case. So you might not give doses or the schedule for medications depending on your style and the style that your team is requesting, but just know the details just in case. This also goes for lab values. It's really beneficial to know what lab values your patient has had in the previous days, but you might not want to mention them in your presentation. But it's always good to know the details in case you're asked, or in case the conversation about your patient heads a certain way that requires that the team knows more details. And try to present your SOAP without notes. It should really be a time when you're presenting your patient and you really know all of these things. You looked at all the notes in the EMR that morning, you spoke with the patient, you examined the patient, you talked with other healthcare providers that morning. So you should really know most aspects of the presentation. The only exception is the O, or the objective part. It can be tricky to keep vitals and lab values straight, so you can definitely peak during that portion, but just try your hardest to present without your notes or with minimal aid. So that's the whole presentation about SOAP notes and presentation.